I absolutely encourage you to look at your beauty products, your cleaning products, the things in your home to try to get that as clean as possible. We love to do detox in our program. It is important to try to rid our bodies of as many toxins as possible. We're likely not going to be toxin free, but we can get pretty close. First we need to look at our home because unfortunately cleaning products, beauty products, the pans we cook in all potentially have toxins. So we want to get our homes as much toxin free as possible. And there are various ways to do that, looking at apps. There's a website, EWG, that's really helpful when it comes to choosing clean products. I absolutely encourage you to look at your beauty products, your cleaning products, the things in your home to try to get that as clean as possible. And then we like to focus on the physical detox, so helping our bodies get rid of toxins. And we want to do that before we're trying to conceive, and definitely not try to conceive during the detox or even 3 months after, because it takes 3 months to completely regenerate the sperm, and also for our eggs to pass through the phases to become mature eggs. We want to allow some time there as well so that their eggs and sperms are in healthy environments after we have done the detox. For the physical detox, we like to offer a few options to our clients. We can do just supplementation on top of what we call the Fertility Reboot Food Plan. And the Fertility Reboot Food Plan is clean eating. It's eating organic as much as possible. It's avoiding inflammatory foods. It's taking out processed foods. We like patients to have a good foundation, at least 2 weeks there, because we want to set you up for success. We want our bodies to be ready for the detox piece, and we even just eliminating some foods that we normally eat is a change in our body and our system, and a detox, so to speak, on that level. So the more we can do in advance in changing our diet, the better. And then when we get to the actual detox itself, it depends on the patient. We'll go through and ask questions and see lifestyle wise and physically wise what their bodies might be able to handle. And we offer either a 30-day having supplements to help your body detox, help your liver to get out to detox, to get these chemicals in a form that our body can then eliminate either in the stool or the urine. So we can either add supplements onto the clean fertility reboot food plan, or we can do those supplements, pretty much the same supplements, but in a little bit shorter time frame, and doing a juice cleanse. And with the juice cleanse, it would be 3 days of raw food in the juice piece, and then 3 days of raw food again to get your GI system used to processing food again, to get eventually back on a more normal food plan.
If you'd like to learn more, please like and subscribe to my channel.